Guys, in this video, let us look at what cranial nerves are. Okay, so basically cranial nerves are the nerves that arise from the base of the brain. So you've taken the brain and you have turned it over. Bottom you're looking at. Okay, you're taking the brain, right, and looking at the bottom. Correct? So now this is the base of the brain, and you're looking at so many nerves coming out of it. That will become the cranial nerves. So remember that you have something called as cranial nerves that is coming from the brain, right? And then you have the spinal nerves which come from the spine. Under spinal nerves, you have the vertebral column. So you have the cervical vertebra and you have so many other vertebra. And from cervical vertebra, whatever is coming are called as the cervical nerves. So don't get confused here with this cranial nerve and cervical nerves. Okay, cranial nerves are also seen. You can say they are from the brain. So guys, there are 12 pairs of cranial nerves. So totally 24, right? 12 on the left, 12 on the right, together 24, 12 pairs you remember, okay? So how to remember the names if you want to remember? There's a mnemonic O, to touch and feel a good velvet. Yeah, to touch and feel a good velvet are heaven, okay? So you have the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal. Then you have the vagus, the spinal accessory and the hypoglossal nerve. Okay. So remember there are 12 pairs, right? And each of them have a specific name. So you have O, to touch and feel a good velvet are heaven. Okay, so this is the mnemonic to remember the cranial nerves. So you have to know what these nerves do, etc. Right? So the olfactory nerve is responsible for smell. Right? Olfactory nerve is responsible for smell. You have the optic nerve which is responsible for vision. Oculomotor and trochlear both are responsible for the movement of the eyeball. Trigeminal is for the sensation of touch. Remember again trigeminal, the mnemonic itself says touch, so sensation of touch, movement of the lower jaw you can say, right? Taste, touch, etc. Abducens is for the movement of the eye movement, not the eyeball movement guys, the eye movement. Facial is again feel it says, right? So taste, salivation, tear secretion, remember tear secretion. Then you have the auditory nerve which is responsible for the hearing, that is called as the vestibulocochlear nerve. Actually A is auditory or the vestibulocochlear nerve. Then you have the glossopharyngeal nerve, that is again gloss and pharyngeal, so the tongue and the throat, right, the swallowing, the gag reflex, you remember. So the taste, salivation, swallowing, glossopharyngeal nerve. Glossopharyngeal nerve is the 9th cranial nerve. Coming to the 10th cranial nerve, the 10th is the vagus, the velvet. The 10th cranial nerve, it is having a lot of action on the heart, on the GIT. It helps in the production of gastric acid, etc. Then you have the spinal accessory nerve. Actually, from where is that coming? It is actually coming from the spine, okay? Spinal accessory nerve is responsible for the movement of the neck and the shoulder. Then coming to the hypoglossal nerve, it is responsible for the movement of the tongue. Hypoglossal, the 12th cranial nerve, the last cranial nerve is responsible for the movement of the tongue. So olfactory, sensation of the nose, optic, vision, which is the third one guys. The third one is oculomotor, the fourth one is trochlear, both are responsible for movement of the eyeball. Then you have the fifth one, the trigeminal. Trigeminal is going to get divided into 3 parts again. Okay, so trigeminal here. Then what is the sixth one? Sixth one is the abducens nerve for movement of the eye, right? Then seventh is the facial nerve, right? Seventh is the facial nerve, written here, facial nerve. So tear secretion, facial muscles movement, etc. is written here, right? That is the facial nerve, 7th. Now let's move on to the 8th guys. 8th is here. 8th is the auditory, right? Vestibulocochlear, right? For the inner ear, auditory nerve. Then you have the 9th. 9th is what? Glossopharyngeal nerve. So that's written here. Glossopharyngeal nerve, the ninth nerve, the glossopharyngeal nerve. So the glossopharyngeal nerve is going to be, basically, it has a sensory and motor part. So the swallowing, right? The tongue, sensation of the tongue, so the taste, etc. Glossopharyngeal nerve. So ninth is done. Let's move on to the 10th one. 10th, where is the 10th? Here. 10th is basically vagus nerve. Remember, vagus is the 10th nerve. Vagus, you should write like this. X, should not write 10 actually. Vagus is the 10th cranial nerve, and basically it has parasympathetic activity. It will work on the heart, and it will work on the stomach, right, on the GI tract, etc. Then coming to the 11th cranial nerve, guys, wake up, 11th cranial nerve. So 11th cranial nerve is very interesting. Actually, it is coming like this, the 11th cranial nerve. It is the spinal accessory nerve, and then you have the hypoglossal nerve, which is the 12th cranial nerve. It is the working on the movement of the tongue, right? Hypoglossal, glossal, so you can guess something to do with the tongue. So from where these nerves exactly arise, if you have to look at, so basically from the midbrain you have the third and the fourth, that is the trochlear is fourth. What is third? Oculomotor, right? Oculomotor and trochlear, midbrain. From the pons you have the 5, 6, 7, 8, right? Then from the medulla oblongata you have the remaining. So guys, as you can notice here, so this is the midbrain, this is the pons, this is the medulla oblongata, right? So from the midbrain you have the 3 and 4, that is oculomotor and trochlear. Then from the pons you have the 5th nerve, that is the trigeminal nerve. 6th nerve, that is the abducens nerve. Then you have the 7th nerve, that is the facial nerve, 2 parts here, motor and sensory. Then the 8th nerve, that is the auditory nerve, vestibulocochlear nerve. Okay, are you understanding that? Then from the medulla oblongata, they have shown the 9th, that is the glossopharyngeal nerve. Then the vagus nerve, that is the 10th nerve. Then you have the spinal root of accessory nerve, hypoglossal nerve, together giving the accessory nerve. So this is how these nerves come out. From these are the nerve. This is the origin of the nerves. So you have the optic nerve here. Okay. So guys, the olfactory nerve is responsible for smell. The first cranial nerve is smell. Remember, when a baby is born, it doesn't use its eyesight. It doesn't use its hearing. It uses its sense of smell. So olfactory is the first cranial nerve. Okay. Then you have the olfactory, smell, optic, vision. Vestibulocochlear is hearing. So these three will become pure sensory cranial nerves. Okay. Then you have the motor cranial nerves, where you have the movement of the eyeball, right? Oculomotor, trochlear, abducent, movement of the eye. Accessory was helping the movement of the neck and the shoulder. Then you have the hypoglossal, which was helping the movement of the tongue. So all these are pure motor nerves. Then you have the mixed nerves. Mixed nerves, you have the trigeminal nerve, which is the 5th nerve. Then you have the facial nerve, which is the 7th nerve, glossopharyngeal nerve, which is the 9th nerve, and the vagus nerve, which is the 10th nerve. Okay. You can also learn the exit foramina for these cranial nerves. Like from the brain they are coming, right? But how are they exiting the skull, right? You should know from which opening the nerves come out. Like the olfactory nerves come out of the cribriform plate. Okay. So you're looking at the bottom of the skull, right, from the inside. So you can see that the optic nerve exits, the exit foramina for the optic nerve is the optic canal. The exit for the oculomotor nerve, that is the third cranial nerve, is the superior orbital fissure. Also the trochlear nerve, also superior orbital fissure. Even the trigeminal nerve, the first part is the superior orbital fissure. Okay. So 3, 4 and 5 part 1 are all superior orbital fissure. Even 6th nerve, that is abducens nerve, is the superior orbital fissure. Okay, they come out from the superior orbital fissure. That is, here you can see the superior orbital fissure. Okay, then the trigeminal nerve actually has 3 parts, right? The second part comes from foramen rotundum, right? And the third part comes out of the foramen ovale. Then coming to facial nerve, that's the seventh cranial nerve, the facial nerve. From where does it come out? It comes out of the auditory canal. From the auditory canal, you have even the auditory nerve. Okay, you have even the auditory nerve coming out of the auditory canal. Then coming to the ninth nerve, that is the glossopharyngeal nerve. Glossopharyngeal nerve comes out of the jugular foramen. Even the vagus nerve comes out of the jugular foramen. And the spinal accessory nerve enters via the foramen magnum. See here, from the skull it is coming, the spinal accessory nerve, and it exits via the jugular foramen again. The hypoglossal nerve exits from the hypoglossal foramen. Where is that? That is this one, right? So from the hypoglossal foramen, the hypoglossal nerve will exit. The cranial nerve, guys, actually they form a part of the parasympathetic system. Which nerves? The nerve 3, that is the oculomotor nerve, the facial nerve, the glossopharyngeal nerve, and the vagus nerve. They form a part of the parasympathetic system. However, in sympathetic system, you don't have any cranial nerves. Remember, only in parasympathetic system, you have the cranial nerves. So take a recap, guys. There are 12 pairs of cranial nerves. That is the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, accessory motor, and hypoglossal. Okay? That's all for now, guys. Bye-bye.